So good morning again. So today we'll be continuing with the previous lectures. First we did the in hand and hands-on training regarding the bronchoscopy. The second lecture was regarding the anatomy, the first part, and then today will be the next part, continuation. That is the third part of the lecture series. And on Monday we are planning to do the hands-on, all the things that we have revised till now, related how to perform bronchoscopy actually, in fact, and that will be for the residents and revision for us also. Right? So I'll be defining here. So this picture. So then I want to ask you, can you name this? What is this structure? Right middle. That's correct. Can you show me what is this one? This is also bronchus, but there are two bronchi seen here. So can you name this? Which one? This one. The arrow. No, this is also rising to the right of the lobe. We said it's the right of the lobe, so this will be continuing to right B3. This is going to posterior to right B2. So that has been shown in this picture. All the structures have been named here. It's labeled here, the previous image was without that. So you can see all the images. This is in the coronal view, this is in the action. For us, actually, in fact, we exactly look at the lesion. The CT film, we must do the FPR. Axial, coronal, and splash, all the views should be reviewed by the physician. So this is what happens. So classically, again this picture, the same CT scan. Can you name me what is this one, what is this one, and what is this one? This is the right upper lobe bronchus. The CT picture was shown to you. Now this is the bronchoscopic image. You have intubated the bronchoscope into the right upper lobe bronchus. So name me which segment is this one? Which bronchial segment? Is it B1, is it B2, or B3? So this is B1, this is the B2, and this is the B3, right? So the answer comes the same. In the particular right B2, in the right B2, we have the two subsegmental divisions also. So this is going posterior, that is B2A, and this is located lateral, so that is B2B. So we can further divide and visualize them in the bronchoscope also. So these are structures we must remember. Similarly, there are certain divisions, such for memory. Here we can see as if there is one trunk, there is another trunk, right? This is also right upper lobe. So what has happened? This B1 and B2 has arisen the common trunk. So like we think that B1, B2, B3 is trifurcation, that's not always true. Sometimes what is there with a combination? So in this particular case, B1, B2 has come as a common trunk, and B3 is a separate trunk. In B3 we have found two subsegmental divisions also. Similarly, thereafter we move forward. This is a simple thing, so you must remember all these images. Once you put in the YouTube channel, you have to advise it at your house, at your home, in the free time. Then we can do practice on Monday. All these structures you have to find out during bronchoscopy. Similarly, this also you can see this is the C4 bronchus, the C4 carina. The B1 and B2 again has arisen as a common trunk. Similarly, there is the four type of variation. So the main cancer variation may happen. So in summary, in the right upper lobe, only in 40% of the cases that we predict that B1, B2, B3 arise as a separate independent ratio. Otherwise, there should be some combination like that has been shown here. In less than 1% cases, the tracheal bronchus may be there like I showed in the last lecture. Now coming to the truncus intermedius, once we have visualized right upper lobe, move the bronchus to the truncus intermedius, and these the structures here in the coronal image. This is the right upper lobe, and this common trunk, the truncus intermedius, is shown here. Then we further divide it. Here also, you can see this is the major fissure, this is the minor fissure, right? So this is the middle lobe, and this is the truncus intermedius after it has given the upper lobe. So here the picture. This we were in the right hand, the right upper lobe, and the bronchoscope is going towards this side. So we'll find out the truncus intermedius. This is the inlet, that is the outlet, shown here. Now we're moving further down. Then we'll visualize and it's always true that this membranous part is very posterior. So one point of difference is where is the anterior portion, where is the posterior portion. The landmark will be all the membranous part or strip will suggest you that the posterior part and the cartilage part is the anterior. So here now is also so. So what happens in this particular picture? Now I cannot take it back, but actually at the top 12 o'clock portion, the middle of the bus, then comes the common basilar trunk, then comes the right B6. That is the scenario in the right side, typically. So here also is the tertiary C4 carina, this is the middle of bronchus medially, this is the right lower lobe bronchus, so the truncus intermediate divides that two parts. And here, now coming to the, that was about the truncus intermediate, where it's the common trunk, where form the division happens, and right middle lobe and right lower lobe. And this is the common picture of the middle lobe bronchus. This is the frontal view, this is the lateral. Just remember, just recall what I have said you. So this is the right middle bronchus, upper lobe bronchus, right? Then is the truncus intermedius. From here, the middle of the trunk is coming, and here we can see the lateral segment is B4, the medial segment of the bronchus is B5, and that will be dividing further. So B4 is, but it's the frontal picture, right? So this is the lateral part, is the B4A, the middle part will be B4B, right? Subdivisions. In the B5, we have the superior and inferior. Superior because it's rounded because the axial image will be taken, so you cannot visualize towards upper side. So this is the B5A, and the B5 superior and inferior, right? In the lateral view, the similar picture, the lateral will be the B4 and the middle will be the B5, and the further similar pictorial diagram you should remember in your mind. So this is the image is flipped because I said last time that just as per the bronchoscopy view, the CT in CT scan what happens, the right side is flipped in the left side, image on CT scan, right? Left side, so you have flipped the image. So that it corresponds to the bronchoscopy. Actually, your parts are right now. Left now, one is CT image. But I have flipped the image, so again what we will see, this is the lateral part, this is the medial part. This is the posterior part, this is the anterior part. So B4 will be the lateral, B5 will be the medial. This is the lower. CT number bronchoscopy similar picture to the case manager. So these things will be revising later. It's quite complicated. I don't want to go into detail. So in the bronchoscopic view, clearly this one is the middle lobe. This is the lower lobe. So 12 o'clock middle lobe, and then we'll go like this. So middle lobe, this is the common basal trunk, this is the B6, right? SL Johnson, you have a line draw or whatever. This will be bronchoscopic image. Visualize also. Again, the subsegmental divisions we can visualize. So remember these things will be quite easier. So middle of bronchus is the bifurcation. There could be the bifurcation, there could be trifurcation. So what we assume B4, B5 is the two trunks that may be arising. But there may be different variations. The most common is the lateral medial pattern. And when middle of bronchus divides into B4 and B2, there is the most common lateral medial. Similarly, thereafter middle lobe bisection also thereafter comes the lower lobe. Lower lobe man. So this is the middle lobe. So this is the lower lobe bronchus. The first thing that arises is the B6. 6 means some of the bronchoscopy image must be but we never. The B6 name. So in the CT image you will be also seeing the B6 first. So again this is the bronchoscope picture. Middle lobe. This is the common basal trunk. This is the B6, right? So common basal trunk will have the B7, B8, B9, B10, right? B7 means middle basal, B8 means anterobasal, B9 means laterobasal, and B10 means posterobasal. And in bronchoscope patient finds to the. So this is the anterior part, right? This is the posterior part. Where essay जाँदाखेरि आपकी तो posterior सबभन्दा तल भनेको medial भनेको this is the medial part, this is the lateral. So there will be B7 will be medial basal part and B7. So then directly 8 to 9 the 10. The next pictures you can visualize. So you can middle lobe before the fact. So right lower lobe now you can the right. This picture also must keep in your mind. So this will depict all up to the sub-segmental divisions. You can go beyond that also, but sub-segmental division of this one is important. So you can see this is the lateral image, this is the frontal image. So B6 is written in the lateral image, so it has got B6A means the right, B6B means lateral, B6C is medial. So similarly, we can define so B7 so the medial basal B8 also, B9 also, B10. The posterior aspect lateral image. Basically, it's quite complicated about these pictures. We will talk detail later on. But again, the image is flipped. Lower lobe bronchus, the first branch is the B6. The B6 is the medial. So this is the same picture. It's the same again the picture. You are subsequent again the same picture, again the similar picture. Now in the CT image, we have to define B6 origin value which is at a branch of the sometimes maybe let's take the then with the B8, B9, B10. So campus and anti-clockwise direction CT scan axial film evidence anti-clockwise direction. B7, B8, B9, B10 anti-clockwise direction. So this has been depicted. Sometimes what happens? Some accessory bronchoscopy that is not quite common. In our study that we did around with the help of Dr. Silzana Patmanamsis, and also Dr. Mahesh, our resident. So we found about 25% of this accessory lower subsuperior bronchoscopy. It means beneath the B6 and B10 road, there is another contraction here. इसमें किस वजह से ब्रोंकस यहाँ राइज पास ठीक है यहाँ मार्केट से यहाँ B6 यहाँ नहीं रोड पैचर ट्रक किया है तो यहाँ देखिए से B6 को देखिए से यहाँ देखिए से but this could be similar to upper bronchus. What is this? This is the extra accessory bronchus that we call subsuperior that can be found, and that's not very uncommon. Again, similar things have been shown here. Just like your picture of one set is the accessory bronchus. This is the middle of this is the video by the segment 8, 9, 10 the accessory. So B6 is above psychotherapy. Same thing is being shown. So now you have visualized everything. Clear side picture. B6 visualize the 7 to the 8 to the 9, 10 everything. So again same thing. B7 is also. One thing we must remember is CT scan. We move counterclockwise, right? 7, 8, 9, 10. 7 and the middle. But in the bronchoscopy, we move clockwise. 7, 8, 9, 10 as well. 7, 8, 9, 10, right? जब कि CT picture में यहाँ जो 7, 8, 9, 10 is so that was the actual image that was the picture was flipped. And the picture it flipped that will correspond totally as the bronchoscopy picture, right? Sometimes B7 may be absent. That in here there should be the B7 that's absent. That's not uncommon. Sometimes this category watch division 8, 9, 8 pounds or 7, 10 pounds. Various variations may happen. The right B6 I showed you. So now coming to the left, that was regarding the right side of the tree. Now coming to the left middle. So this picture you also must practice many times. Draw the illustration. I'm quite happy and proud that among all of us, Dr. Sagar is the best one who can draw the illustrations very well. I think that should be the inspiration for you juniors. You must also, since you are service, you must know how to make the good illustrations. Good illustrations, once you do it, you will recall all those things. You will recall all those analytical movements. That's very essential. It's a very good point. If you have not developed now, I'm quite older. My illustration is not very good, but I think I learned from him. The illustration is very essential for juniors. The illustration make your picture draw as a division. So make your habit that at least for 1 month, every day you get a picture. It will take about 10 minutes of time. Then you will, after at the end of 1 month, you will never forget how to make the segmental diagram of the lungs. So that's very important. So again, in the left side, left main bronchus is the right bronchus. So it will divide it further. So same, yeah, there are this primary cover. The right bronchus, the left main bronchus, I said is longer than the right. Right? This length is 4, 5, depending on the height of the patient. So how tall it is, the taller he is, the longer is the bronchus. Now the left main bronchus will be divided into 2 parts, like left upper lobe bronchus, that will division will be happening at the level of the secondary canal, and the left lower lobe, upper lobe, lower lobe. So if you go into the upper lobe further, that will have the superior division and inferior division. Is this the inlet of the left main bronchus? Is the left main bronchus again shown with the length? The secondary carana will be visualized. Then you can see the left upper lobe bronchus here. So this is the C2 carana, the further will be the C3 carana and C4 carana, as I mentioned in the last picture. The membranous part will always locate posterior. So that way you can just estimate what is that when you are confused with the tumor infiltration, you don't know where is the anterior posterior part. Follow the membranous structure. So again, same one. Then from C2 we are moving to C3 current. This is how we should move and how should we move. So now we are in the left upper lobe. So left upper lobe, you can see, consists of the superior division, this one, and the inferior division, which is bounded, the boundary is the C3 current. In the superior division, again, we have the hypoposterior to the B1+2. This is the B3. This is the lingula, that is the inferior division, consisting of B4 and B5. Then comes only the lower the picture. Now let's come this one regarding the left hand. Let's come to the left upper lobe. This picture is also very. So I would request you please remember this picture step by step. The upper lobe like the right side to left, this for the left side. So here we can see this is the left hand lobe. So in the frontal view, this is the superior division, right? Where is the inferior division? It has not been depicted when this should be the inferior division. Then this is the B1+2, A, B, C, and this is the B3. This is the division. It's very important that the lingula is here in the back. So this is the superior division. This is the inferior division. So this is B1+2, A, B, C, and this is the B3 segmental division, which also contains A, B, and C. So this is very important. Now coming to the next part. So now we have moved the superior division of the left upper lobe. The superior division you will visualize this is the left B1+2, this is the left B3. Then coming to the lingula or platform. So it's not only at the level of the lingula, we can see this is the superior lingular bronchus, left B4, this is the inferior left B5. That can be seen in this picture. Again, the similar picture is shown here. C3 lingular carina, this is the C3, which makes the boundary between the superior division and inferior division. The left upper lobe is the lingula, this is the proper B1+2 and B3. Again, B1+2, B3. The lingula now divides into B4 and B5. The left side is the superior inferior because our scope is turned lateral, that's what it's like this. Otherwise, B4 will be here and B5 will be here. Superior inferior. And this layer of the lingula, again, this picture, remember, is the frontal view, cranial, frontal, middle, lateral. And the flip pass is so the image of the text, say, Thakka yad pan, where is the B4 means the superior, B5 means the inferior. Superior will divide into B4 A and B, right? Lateral and J versus sometimes lateral. So B5 and B5A is the superior, B4 is the inferior. So this much you must remember in the frontal image and the lateral image. So now there could be certain variations that will confuse you. So this is the left upper lobe numbers. This was the left upper lobe numbers, like this pattern. What do you think, Sandeep? This question asks, what according to you, which one is this one, which one is this, which one is this? Just guess. There is a variation.
So Matthew was a 1+2, the other was like 3 to A W.
3 to A W. Now let's see. The question comes, is it B3 or B4? That's the main question to us. Definitely his correct was the B1 question. This we remember that difference from the C3. When I look at the current first, there is the C4 current. This now again C3 lies higher, C4 lies deeper, right? So this is the upper division, this is the lower division. So this is LB4. So get the question B3 B4. When you divide the current with the C4 current, upper division lingula, is the B3 is the so you may first think of the carina locate. That's not always true because sometimes split variation may happen. But in general, I have a carina landmark. So generally divide versus go upper division will be different ones. So this therefore this is the pattern of the left superior left upper lobe. So what are the patterns? There are various patterns. The most prevalent pattern is the bifurcation, where B1+2 and 3 in the upper division and then with the upper division consisting of B1+2 and B3, and the lower division consisting of B4 and B5. So this is the most prevalent pattern. Now coming to the left lower lobe. So this again is pictorial diagram, very impressive frontal view and the lateral view. The frontal view is first thing comes the B6, then comes the basal trunk. Only difference is that right now it is being said that even the medial basal segment B7 is supposed to be absent in the left side. It has been found that about 25 to 30% of the cases B7 does exist, but during the nomenclature process, the B7 is not present in the left side of it. So it depends upon your consensus, your philosophy, whatever. But if it is preserved, it will be helpful during second treatment. If it is not present or absent or really present during the lobectomy, it doesn't matter. But anyway, the general consensus as of now is left main version B6, B8, B9, B10. B8 means 7 plus 8 combined. Therefore, we have 8 segments to the left side and 10 segments to the right side. Similarly, the CT scan is this is the pattern that we can visualize. So, what's your error to your follow-ups are could be partly ago. It has made some mistakes in the illustration. So, I've corrected it. So, this is the left B6, the lateral B first right, the left B6 lower lobe, and this is the common direction. Then here again the similar pattern. So the right hand number is 8, 9, 10. 8 one equal anterior basal, B 9 one equal lateral basal, 10 one equal posterior basal. So in this scenario, you get this variation of structures. So again here 8, 9, 10 So there are several variations. Also the most prevalent is the single stream of the lower that bifurcates. So it could be B6 the bifurcation B6 to variation. So B6 को sometimes B star that is the accessory subsuperior bronchoscopy pattern. So these are the patterns of the variation from the tree that sometimes what happens during bronchoscopy is not quite unusual. The particle we are visualizing here seems a cup like a structure. Is it the blind diverticulum, developmental blind ending? That may happen. That is just like diverticulum. And bronchos continuous blinded diverticulum. The term is here treatment just to take insert problem. What happens quite often you see this pigmented lesion, black is pigmented. Is it the melanoma? Question also. Melanoma happens in the inner part, mucosal part, not is coming from semicula. So nothing is the normal white follicle or an out pattern if the mucosa is still black, like the charcoal is still due to smoking or household fire to carry anthracotic gas is not common nowadays, but it's very quite. Sometimes what happens, a condition called tracheobronchopathia एकदम deformed bronchial tree हुन्छ न्यारो हुन्छ यस्तो किसिमको ट्युबरको जस्तो थुप्रो हुन्छ त्यो चाहिँ यो कन्डिसनमा आउन सक्छ I have seen only 3 times in my lifetime. Sometimes what happens tracheomalacia when it's the narrow no compression nothing but just flattening this very floppy type of the tracheomalacia. That's for the tracheomalacia. The same is the external compression can happen. Sometimes what happens, this picture or this कोही पेसेन्टको न्युमोनेक्टोमी भएछ त्यसपछि उसको एम्फाइमाबाट आयो भने one of the investigation comes the latest 3 months 4 months after we suspect that there is the empyema then do the find there is a deficiency of the stump where you had a staple suture because pneumonectomy is so this is the general diagram. You must remember this all disrupting the stump. So this is the final picture that you should recall in your mind and like during